Across the world, many or millions of women still face fertility issues, and IVF and egg donation offer real options of motherhood to some of these women. However, the issues around stigma, silence, confusion still surround these birth options or these options of experiencing motherhood. So today on Gyna Plus, an IVF expert will be joining me to throw more light on what this is all about, who is eligible for these, and at what point should you consider these options. My name is Doris Mayushishi, and of course, this is Gyna Plus, a program for women and girls where we talk about health issues that help them live healthily and, of course, become better people health wise, if you ask me. This program comes up every Wednesday at 6 p.m. and sometimes a repeat on Saturday at 8 p.m. And right after the break, you will meet my guest. Please stay tuned. Thank you for staying tuned. If you just joined us, you're watching Ghana Plus right here on Afia TV, and this is a program for women and girls and children. And here we talk about health issues that affect women. And today, I mentioned a while ago that we're looking at issues concerning IVF and some of the stigmas you have. What have you really heard, really? What did I say that you think it might be wrong? So today you get to learn more about IVF. And joining me in the studio to do that is Dr. Onwudiwe Elijah. He is a consultant obstetrician and gynecologist, as well as an IVF expert, and also the MD and CEO, Pink Petals Fertility Clinic, Enugu. It's so good to have you, Dr. Elijah. Welcome.
Thank you, Doris, for this opportunity to talk about our women and infertility.
I've heard about you a lot of times, but it's such an honor to finally have you on my set. So we'll begin with, we don't have too much time to, dabble around. We'll begin with you giving us a background to what IVF really is.
Yeah, thank you very much. We can't talk about IVF without talking about infertility, because after marriage, we expect that after 9 months, somebody will be crying for us to come and celebrate. But sometimes it doesn't happen that way. So if there is inability of a couple to conceive after 1 year of regular unprotected sexual intercourse, then we say that the couple has infertility. And there is
1 year.
Yes, of regular unprotected sexual intercourse, especially for people below 35, a woman that is below 35 years. We call that infertility, and there are so many treatment options for infertility, including medical treatment, including surgical treatment, and also ART, what we call assisted reproductive technology. IVF is one of the assisted reproductive technology treatment options. So what's the meaning of IVF? IVF is an acronym for in vitro fertilization. That means fertilization outside the body. Because when we talk about conception, it has to do with the egg and the spermatozoa from the man, spermatozoa, and the egg from the woman. Two of them will come together to undergo what we call fertilizations to form an embryo, a miniature baby. And this complex thing happens in the reproductive organ of a woman. So if egg is released during ovulation and during sexual intercourse, spermatozoa are released. One of the spermatozoa will enter into the egg within the fallopian tube, and what we call fertilization occurs. After fertilization, the fallopian tube carries the embryo back into the womb, and implantation occurs within 5 to 9 days. And that is when we say that the woman is pregnant. So if we try to mimic this complex cascade outside the body within the lab, we call that in vitro fertilization. So that's the full meaning of in vitro fertilization.
All right, thank you. So I'll take you back quickly to what you said earlier, that if a woman, a couple engages in constant sexual intercourse for 1 year and there's no pregnancy, it's them to be,
infertility.
So, but couldn't there be other options that would be first considered before one would think of IVF? So if that's the case, given the explanations you've given, what should be the proper procedure before one would say, okay, let's go for these options? That's, from a medical point of view.
So if a woman does not conceive, most of the time in our own society, they think that it's just the woman. So you want to just go to the hospital, it's your own case. But when you listen to what I said about the definition of infertility, it has to do with the couple, the man or the woman. And inability to conceive can be caused by the female factor in 30% of the cases. In another 30% of the cases, the male factor, and another 30% combined factor. The remaining 10% will be what we call unknown factor. If a couple walks into a clinic, a fertility clinic, or a gynecology office to consult, the first thing is to take history, get information about it, then the couple will go through investigations, and a diagnosis will be made before recommending a treatment. In some cases, it will be maybe they are not having adequate sexual intercourse. The man may be in Japan and the woman is here in Nigeria. If you don't have regular, unprotected, adequate sexual intercourse, there's no way you're going to have sex. You're going to be pregnant. When we mean adequate, that means up to 3 times a week, spread apart. And it has to be a vaginal sexual intercourse, because nowadays there are so many types of sexual intercourse. I mean a man to a woman, not a man to a man or a woman to a woman.
Okay.
So conservative, that would be the first thing to advise. Go do this, or that you're not doing this. This is what you're supposed to do. That's the first thing. Then if there are medical condition that were found out during the investigation, the next step is to address that medical condition. Like a woman may not be ovulating, what we call anovulation. There are drugs that will cause the woman to ovulate. So these are the
that might
steps.
be given.
Yes, that's
Then
what I
if
mean.
after all these options are exhausted and there's no result, it might
Yes,
not consider.
consider IVF.
Okay.
And some cases, IVF may be the first option. Whereby a woman comes in and the fallopian tubes are blocked, it can't be considered any other option than to go do an IVF, because the route that are going to take is not through the fallopian tubes.
Okay, so now at this point, how much of awareness do you think people around Enugu have concerning IVF? There have been stories around, there have been myths, there have been some sort of stigma. Sometimes you get pregnant, maybe she delivers triplet. The first question they ask, is it normal or IVF? So it seems like, okay, so she was assisted to do this, so it's not considered as a big deal. But then again, what is the procedure like when it comes to success rate, awareness? Look, just talk to us about that briefly.
Yeah, IVF, first of all, is that we should not look at it as an artificial baby. That's the problem. There's not like an artificial baby. It's just a form of help and assistance to a woman for the person to succeed. It's not that a sperm is manufactured outside or an egg manufactured. The only difference is that instead of taking place in the fallopian tube, it's taking place in the fallopian tube outside within the lab. So
That way you transfer it back to the woman's
transfer
body.
it back to the woman's body. So there's nothing about it being normal or abnormal. Somebody needs an assistant. That's what was done. In terms of information, before now, people don't really know about IVF, but a lot of awareness are going on about IVF. Even through the Association for Fertility and Reproductive Health of Nigeria, they dish out a lot. Even for us within Enugu here, people know about IVF. However, the problem is that most people do it, they don't come out to tell you that I'm doing IVF for substance, but people know where they can get an IVF services. So it's not something that is not, we are aware, but people still also put stigma into it, because some people will come out, they will not tell you that they had an IVF. Meanwhile, it's very important, if you're giving a doctor your conception, what we pass through, it's going to make the doctor be more careful about what the kind of pregnancy. A woman has waited for 15 years, and all of a sudden, the woman conceived through an IVF. What a joy. It's left for you to tell the doctor or whoever that is going to say, this is a procedure we went through, this is an IVF procedure. So the doctor will be more careful in terms of attending to the woman. The process of an IVF involves registering, then the man and the woman goes through a series of investigations. Then after the investigations, then there are several protocols of IVF.
Okay, before
Yes.
you the protocol part, and then before we take a break, what age should a woman be? Are there age limit to these things? If so, for instance, I'm in my 30s and probably been married for 2 years, do I consider, or maybe I want a baby boy, sex selection? I've heard all of that. Some of the reasons why some women or families consider IVF. Is that usually the case?
IVF is not 100% in terms of success, but it's how much more higher.
Well,
It's higher
what
than
is the chances? Like,
yeah.
What are the chances?
What determines the success rate of IVF is majorly by 4 major things. Number one is the womb. If the womb is good, the inner line of the womb, the chances of conception is good. Number two is the embryo being transferred, which is a function of the spermatozoa and the egg quality. Because the spermatozoa comes in millions, the egg comes but a few. Most of the time, the success rate is determined by the quality of the egg. And the quality of the egg is determined by the age of the woman. You know why? Because when a woman was staying in her mother's womb by around 20 weeks, she had about 7 million eggs. At birth, 2 million remaining. She must have lost about 5 million during the course of her gestational life. At puberty, when she started menstruating, the normal remaining should be about 400,000. So from that time of puberty till whenever the woman loses about 30 to 50 of those eggs, that's how they continue to leave the ovary until the ovary becomes empty. I would say the woman has gone into menopause. So the as age decreases, the chances of conception goes down, the chances of miscarriages goes up, the chances of having abnormal baby also goes up. So
What is the
at
right age then?
at people below that 5 years, they have up to 30 to 50% chance of conceiving using their own egg. Between 35 37 years, it drops about 25% chance. Between 37 40 is about 15%. Anything above 40, you're looking at about 6 to 10%, which is low. However, if a woman decides to use an egg donor, if you use donated egg of somebody below 25 years using the husband's sperm, the chances will go up to 40 to 50%. So the next thing that determines the success rate will be the technical factors. How easy, in terms of the embryo transfer, how easy was the embryo transfer? It was, if it's difficult, the chances of conception is low. That's why during the investigation, if there are difficulties in trying to transfer the embryo, what we call mock embryo transfer, some things will be done in order to open up the womb before the transfer. The finally gut factor, just like a farmer going to the farm, you prepare the soil, sow 4 seeds or sow 2 seeds. At the end of the day, you don't have control about the number that can germinate. 2 of them can germinate, 1 can, and none. So these are the chances of
Okay, so the thing is
success.
that I have a lot of questions. We've talked about so many things, but just one question. I just need a direct answer, and then we take a break.
Yes.
What age? At what age? What age is a women, or what is the age bracket that should
Below 53 years, anybody can do an IVF. But in terms of using your egg, you can do IVF at below 53 years, and you are an adult that want to conceive. So there is no in terms of the age, but
But
the
your egg,
success will determine what you are using your egg at what age. So
Okay.
at 41, you want to use your egg, your chances is low.
like how many percent low?
Is 6% or below. That's what I said. Below 6%. As the age increases, the chances drops. Anything above 40, you're looking at within 6%, and so that's how it continues to drop, and they drop to 0. Of course, somebody that succeeded, for that person is 100%.
Yeah.
If you fail, is 0%.
We'll come to this definitely. You're still watching Guide of Yours right on that television, and the discussion has been on IVF. And I mean, I have so many questions to ask Dr. Elijah. Egg donation. He talked about donation. He talked about sperm. So many terms. But then again, we'll take a break, and once we are back, we'll get to hear more of these. I'm sure you're getting to learn as well. Please stay tuned. Welcome back. If you just tuned in, you're watching Ghana Plus right on Africa television. And my name is Doris Mayim Shisha. We're talking about IVF issues, fertility issues, and of course, Dr. Elijah Omudiwe is still here in the studio. And of course, he is an IVF expert as well as the MD and CEO Pink Petals Fertility Clinic Enugu, and he is also a consultant obstetrician and gynecologist. So you can see that this is the right person for this topic. We talk about quite a number of things, so many technical parts, and then of course part that you will understand. But then, Dr. Elijah, I'd like you to talk about, you mentioned egg donation a while ago, that if I got it correctly, that if a woman is maybe gone past a particular age and decides to use an egg donor and then uses her husband's spermatozoa, just like you said, the chances are that they might still have a baby. But the question around ownership of this baby, would this woman be eligible to call the baby her own in a case where someone that person carried? I mean, the egg donor thing, maybe she uses someone egg. Just get put me through because I'm getting confused.
In
saying it.
in assisted reproductive technology, there's what we call third person assisted conception. Usually, it takes 2 to tango, a man and a woman to have a baby. But sometimes, because you need some assistance, there may be a third person that may assist, either in form of donating his or her gamete. Gamete is the egg or the spermatozoa, whereby a woman does not have egg, past age of menopause, or that her egg, she has very low ovarian reserve. Another adult, that a lady that is above 18 years and below 25 years can decide to donate egg to her. And in doing so, what determines the genetic component? Because a baby is not just like I said before now. A baby is not just the genetic component. A baby is the makeup involves both the gene and the environment. So you're asking, is it still the baby of that woman? Yes. 50% genetic component is coming from the man, and 50% genetic component is coming from
The donor.
the donor. However, in terms of the blood supply, it's getting 100% from the mother. Yes, the environment matters a lot, because the man that just did is just the part of the gene, but what a baby becomes is developed mainly within the first 3 months of, uh, of delivery. Do you know why? Because the environment has a lot to do with the
Environment,
with
in
the
this
baby.
case, the womb.
Yes, from the womb, from the breastfeeding, and from the environment, the training you give to that child within the first 3 months. If you deliver a baby here in Nigeria and take the baby to White House, bring that baby in the next 12 years, it's not going to behave like an African. It's going to behave like the child of an American president. That's how it works. So the blood supply, the nutrient is coming from the mother. And when it's delivered, of course, the breastfeeding is from there, and also the environment. We have cases where you had no sperm, the woman has no egg, donor sperm, and the baby comes out looking like exactly the mother. So
Donor egg, donor sperm, and okay.
and the woman and the baby start looking
Yeah,
at
the parents.
exactly the parents. So you wonder what happened. So sometimes you ask a man and a woman married, after some time they will say these two people are resembling.
alike,
Yeah,
yeah.
the environment matters a lot about it. So it's not about just gene alone. Gene is the container carrying what somebody is. It's just that's what we should know.
Oh, okay. So the thing is, this is getting more interesting, and at the same time, very. I'm learning, and I'm shocked at the same time, because the things I hear now, I think I probably would have argued outside if we were not coming from an expert.
Yes.
But then again, what are the concerns around stigma? Because could this be the reason why some persons don't want to disclose the fact that, oh, I had my triplet via IVF? They'll tell you, okay, God is a miracle and stuff. So what is it like in the world out there? You meet these people every day. What are the concerns when it comes to stigma, confusion, and judgment around people in the society? How much of that is a problem to the whole IVF thing?
The Bible says that my people perish for lack of knowledge. And most of the time, those people that hold that stigma, hold it very tight, is because they have not had the knowledge. Like we are discussing now, sometimes a woman will say, no, my husband will not agree to use a donor egg. I say, bring your husband. When your husband come, we'll discuss the reason. You give 1, 2, 3. If this you allow this woman, people are waited for 15 years and they don't want to have a baby. This baby that somebody is donating egg doesn't mean that it's not the person that you are not the owner of this baby. By the time you explain this to the man will understand. You say, go ahead. And lo and behold, when the baby comes, the joy will cover every shame. And you see, some people even want to say, let me tell them that I delivered through IVF. I know women that want to come out. I have pictures in the office of women that deliver triplet. Even their pictures are there, both the woman and the children. So it's a matter of the education about this. We go around telling people that IVF, you can't attach stigma to an IVF. You can't attach stigma to somebody that's infertile, somebody that have not had a conception for a while, and still attach another stigma to somebody that, is outside. There are people that are very happy that they have their baby through IVF. Even their donors will come out and say they have donated this egg to, or even the people that donated spermatozoa. But environment, you can't discard our culture. So we marry the culture and also the treatment we have. So people are becoming aware, but the stigma is still there, and it can't go. It can go. However, we have to try as much as possible to reduce it as much as possible through this medium that you are presenting.
Okay, so I have one question that seems not so odd, but it's still around egg donation and stuff.
Yes.
But what are the processes that makes one eligible to donate egg, for instance? Are there some sort of screening that have to be taken on? And then that's one part. The second part is how safe is it? Because I hear, we go recently, I saw some stuff online. People are lamenting that university girls now walk up to fertility clinics and say they want to donate their eggs, more like sell their eggs sort of, and then get paid to, live well. What is the risk? What does this really entail for such girls? And just give me a scope on this line. Really.
Yeah, for egg donation is a process where an adult female above 18 years have agreed to help a couple that had difficulty in conception. And the lady has to go through series of screening. When I mean screening, clinical screening, psychological screening, and every other screening that is involved. Those screening that the intending parents are supposed to go, they will also go through it. You mean like viral screening tests, HIV, hepatitis B, hepatitis C, their hormonal assay, blood group, genotype, all those things. Then you match the donor against the recipient. You can't get a Caucasian to match somebody that is that. So we look at the height, the eye color, the hair color, the complexion before we match it against the woman that is going to carry the baby. However, we should know that egg donation is not going to, it's an altruistic thing. It's not meant to be something that somebody will, if I want to sell my egg. No, ethically it's not allowed. Nobody can donate. And it's against the law for you to donate any part of, to sell any part of your organ. However, it's allowed for somebody to help somebody to donate. However, what you are being paid or what they receive is just like compensation of what the expenses in terms of transport coming, the logistics that you paid. So that is wrong word using selling, and people don't know how it works. You just stay at the comfort of if you're home, say people are selling their egg. And however, these eggs are supposed to be wasted. Like during my intro, I told you that every month a lady within the reproductive age loses about 30 to 50 eggs. So during the IVF, what we do is she goes through some injections to bring out those eggs that are supposed to be wasted. Then it will be collected. So instead of wasting, she needs to help some other people to
so
achieve
later on
that.
in life, that person too can still have their own children. There's
nothing that whether you donate egg or you don't donate it is not going to affect your ovarian reserve.
Okay.
It's not going to affect. However, there are some certain level where you donate. For us, you don't donate more than 6 times, and also there should be a maybe 3 months gap if you want to donate.
And there's a certain age bracket.
There's certain it should not be above 25 years.
Okay.
And it should not be below to 18 years.
But is it a safe procedure? Like, is it something that you get injected?
It's not something that you go to Oboete market, and it has to be through a specialist. Okay. There are complications that are associated with that in terms of donating egg, just like everywhere. Because of the injection, the person will go through some injections. The pain of the injection at the side, the lady can also have what we call ovarian hyperstimulation, whereby because of the so many eggs collected, she may be bloated. However, it's something that is going to be managed within a few days. She's back. So it's not something that somebody is not a sinister procedure that people the way they look at it, but it has to be done by a specialist. If not done by a specialist, there are so many complications, including injury to the surrounding organs.
Oh,
yes.
Okay, so two more questions before we go. And one, it's the cost. I hear it's very expensive. Now, coming from the fact that this is something you do, can an average woman who's been battling infertility issues just stroll into your clinic and say, I want to have this procedure because I need a baby? How affordable is it? Just give us, you might not mention any amount, but just maybe a scope, a range, or just, how you explain it, whether it's affordable or not, and then the failure rates. How often can they come back after they tried? What is it like?
Yeah, when we look at the cost, we don't just look at the cash. We look at it wholesomely. A woman that have been going through so many drugs, going to some medical doctors, has spent a lot, and now you want to do a treatment that is will give you a better outcome. So the cost is not something that is, but it's very cheap in Nigeria compared to what is gotten outside the country. It's average in Nigeria between 2 to 3.5 million naira can get you a cycle of IVF within.
A cycle means with
one-off treatment.
But if he fails and you go back to status quo and then try again.
Of course, now you can you are still going to pay. However, there are ways where you can reduce the cost because the person is coming back. Okay. However, if you have more, you can be frozen, it can be stored, so that you can come back at a later date to have your baby instead of going through the procedures again.
And that was going to be my last question. But before we take that last question, we'll just take a brief break, and of course, we'll be back. Please stay tuned. Ghana Plus returns in a moment. Welcome back. For a minute, I forgot I was even going to take this break. I mean, you're still watching Ghana Plus right now for television. And my name is Doris Mayum Shishi, and of course, my guest, Dr. Elijah, is still here. He is an IVF expert, and we are talking about IVF related issues, assisted birth, egg donations, freezing of egg. It's a whole lot. And for me, I mean, there've been sort of demystification that has taken place. Like a lot of myths I had prior to now, I've learned so much. Thank you so much, Dr. Elijah.
Thank you.
But as we wrap up, you mentioned something before the short break that, however, if a woman is not ready or they can actually freeze and store their eggs, which woman is it? At what age can I store my eggs? And what is the success rate if I come back to use this egg? And what is the cost in terms of just 2 minutes and then we're out?
In 1953, we started sperm freezing. 1983, embryo freezing, that's baby frozen. Then 1984, egg freezing. If a woman is still looking for Mr. Right, then Mr. Right is not coming, and you are hitting 30, 32, 33, 34, 35, it's important that you freeze your eggs, because from 35 years there's a sharp decline in terms of the egg quality. So as much as possible before 40, if you have not had Mr. Right, you can freeze your egg. Egg freezing means that we're storing it in liquid nitrogen minus 196 degrees centigrade. So it's just like every biological activity stops at that. It's just like person life. Then anytime you are ready for you to maybe the meteorite is there and you want to use your egg again, you come back, the eggs will be thawed, they will come back to your original state. As me you stored it 10 years ago, you come back to that original state, then it can be used to do an IVF. The same thing with embryo. You can freeze your babies. At the end of the day, you can come back, transfer the baby. That's what gives us even result, what we call embryo freezing. If you are not ready, you can do treatment, or you have so many babies, you can just transfer to keep the others. When you are ready, you come back. You won't go through the stress of injections and through the IVF processes. Or that your husband is not here, is maybe in US, you're here, and he can donate his sperm, keep his sperm. It can be used to do IVF. You can have your babies throughout the period your husband is not around.
Okay, so this is a lot for me. I'm just trying to process all of this information at once. Thank you so much, Dr.
Thank
Lada.
you.
But then again, if all these eggs are frozen and I get to change location, I'm not within the same. Am I allowed to carry it? How is it? What is it? An injection or there's an extraction? What is it like, really?
It's in a tank, what we call dry shipper. I have people frozen their gametes maybe in US that want to do treatment in Nigeria. They'll write the clinic, they'll transport it through a dry shipper. That liquid nitrogen in a tank, it will come back to then we put it in our cryo bank, preserve it, and continue the treatment. So it can transport anywhere you are.
And if you exceed 53 years and you still want to have your babies, you can't, am I allowed to carry them because they're my
No, you can carry them, but the medical condition that are associated, you can have hypertension, diabetes, and other difficulties for a woman that is at that age.
All right, we're going to have a part two of this conversation because it's not going to end here. We will definitely come back to this topic. And you've been watching Ghana Plus. Thank you so much, Dr. Elijah. I mean, we've been chatting with Dr. Onwudiwe Elijah, who is a consultant obstetrician and gynecologist, and also an IVF expert, as well as the MD and CEO, Pink Petals Fertility Clinic, Enugu. Such an insightful discussion, if you ask me. And this will be up on our YouTube channel, Afia Culture and Lifestyle, so you can learn more, share with your friends, and let's spread the news. Thank you so much. It's been a wonderful. Thank you.
Thank you. I appreciate it.
My name is Doris Mayum Shishe. Have a lovely evening.